I'd like to call this health board meeting to order. Got any changes to the agenda?
We will be entertaining closed session.
Motion for the agenda, as is.
Motion.
Do we have a second?
Second.
All in favor?
Aye.
Approval of minutes, regular minutes, August 2nd. You have a motion for that?
Motion.
Do we have a second?
Second.
All in favor? Do we have any public comment? I don't think so.
Nope.
Okay. We're ready.
All right, so, we have finished up the annual report, for fiscal year 2020, 2021. Let's see if I can find it. It was right here. And we did actually accomplish a lot of things that were not COVID, shockingly enough. So go on down to page, I think it's 4. These are all of the highlights that we, things we had take place in 2020 and 2021. Obviously the pandemic consumed the majority of our resources. We actually have the tele-OB program, hopefully beginning soon. Actually, the only reason that it's already not running is we're having some IT issues. I know everybody finds that surprising. But we're having some pretty significant IT issues. And so as soon as we can get those worked out, all the equipment is there. The clinic, as far as how they're going to run it, is already set up. They're actually ready to start taking appointments. They've just got to get, basically, they are going to have the capability of doing ultrasounds on site at the health department, but they're having trouble getting that ultrasound machine to show real time at the clinic in Silva. So it's pretty complicated IT, so I totally get that. It's just taking a little bit of time to get that IT fixed. So we did get the school-based health center launched. It is going very, very well, best I can tell. That is a Debbie McDaniel is the one that staffs that clinic, and the kids seem to love her, the parents seem to love her, so that's actually going really, really well. Pretty proud of that program. So especially since it's only been running since the beginning of the school year, so that has actually been a pretty huge success for us. We also launched the 2 peer support specialist positions for the Recovery to Work grant and the Community Linkage Care grant. Both of those programs are doing very, very well.
Right.
Yes.
Congratulations.
Thank you. Both of those folks are doing really, really well. We actually met with Inspire, which is the regional group that mimics the Recovery to Work grant and are calling it Recovery to Career. We met with them last week with Bethany and Clint about taking our program and expanding it and making it larger. So that's actually going really, really well. The continued collaboration with Appalachian Mountain Community Health Center on the $1 Million Opioid Response Grant. They actually, in follow-up to this grant, got another grant for maybe more than $1 million. I can't remember. That one is for the next 5 years on stimulants. So while this was an opioid grant, the one that follows this one is stimulants. So it addresses your ADHD medications, people that are using and abuse those, but also meth. So that's a new grant program that they've got that they just accepted this federal fiscal year.
Thank you for your work on that, Beth.
Oh, you're very welcome.
Could you tell me what page 4 you're on?
I am on which page am I?
Just give me the heading from the page.
Okay, it is the highlights.
Okay, gotcha.
Yeah, it's got a big star in the background.
All right.
I really need to add page numbers, don't I? We also started working with the students and staff on a variety of education topics at the request of the students and staff, so we actually had them pick the topics. And we have already gone in there and done a program called Avoid, which is about vaping and cigarettes. They have already completed that program with, I think, the elementary and middle school, and that went really well. Ivy did that. So she finished that up, I think, last week. So that went really well. We developed and launched the Detention Center Inmate Screening Program, which offers vaccinations, STD screenings, treatment, and education. We started that this past spring in midst of COVID, and it was extremely well received. The inmates actually loved it. We were able to vaccinate several of them for hepatitis A, hepatitis B. We actually had some that are requesting their COVID vaccine. I think we've done a few Tdaps. What else have we? I think that's pretty much it.
Were you able to do that, Beth?
Yes.
Give them the COVID?
Well, we want to do the COVID vaccine, but they stay in an outbreak status.
Right.
So we can't go back in there. As soon as we can shut down their COVID outbreak status, then we'll definitely go back in there. They really have enjoyed the education piece of it a lot more than I thought they would. And we have gotten some of them that are requesting STD testing. They're self-attesting to being like hepatitis C positive, and we're helping them get their treatments and testing and all that kind of stuff. So that actually has gone extremely well. We also launched the community paramedicine program under the health department, and I have his update under his section, but that is actually going really well. He fluctuates somewhere between 18 and 20 patients on his caseload. We also collaborated with the WNCAP, which is the Western North Carolina AIDS Project, to continue the Clean Needle Syringe Exchange Program. That it continues to go very well. We have been able to hand that partnership off a little bit to Michelle Shiplett's Liberty Church and all of them. So we've been able to kind of take a back seat on that particular program because it's going really well and doesn't need our help, so that's really good. We also completed our 2020 State of the County Health Report. We are coming into a new community health assessment cycle for 2021, so we will be doing focus groups in the next month or two. And we worked through the beginning steps of Medicaid Transformation, which, as I'm sure everyone knows, has been quite an event, to say the very least. We have actually done okay in the midst of Medicaid Transformation. A lot of folks have not, but we were able to shave back a lot of our services to where we didn't take the hit that a lot of them took, and we've actually been able to make more than I originally forecasted, even in the midst of Medicaid Transformation. So we're doing all right. COVID-19. So we have been collaborating with CCNC, which is a big state contractor, to do the contact tracing because in the heat of the Delta outbreak, it was impossible, honestly. They were rolling in by 30 and 40 cases a day. So we did hand off a lot of that to CCNC. We have been able to take some of that back as our caseload has decreased. So we did make home visits for testing last fiscal year. For those that couldn't make it to the health department, we did make arrangements for them to be tested in their home. We also did grocery pickups and drop-offs for isolated individuals that couldn't make it to the grocery store. We would either actually drop the groceries off ourselves, or we would make arrangements for somebody to pick them up and take them. We assisted with healthcare and social service referrals for folks that needed them. We transferred and transported vaccines all over the western region, especially during the big shortages of vaccines. I would be anywhere from Cherokee County to Buncombe County picking vaccine up. So we also provided infection control guidance to restaurants, local businesses, healthcare facilities, the hospital, and the school system. The school system remains an ongoing trial with us as we continue to work our way through the mask mandates, the masks optional, and the increasing the vaccinations in children. So that partnership continues. We have maintained our case counts and our reportable data for mass media. And honestly, responded to phone calls and voicemails into the thousands at this point. We have collaborated with AMCHC to provide community testing when it first started. Now, obviously, testing is widely available. We collaborated with the Healthier Together and Vecinos to get our after-hours vaccines, and people that were homebound and do event vaccinations and that kind of thing, because Vecinos is the folks that have the mobile vaccine unit. So they were able to come out and set up wherever they were needed, or do any kind of homebound event. So, and obviously we were administered at this point over 5,000 vaccines in the last 12 months. We have launched mass COVID vaccination efforts, and we will continue that into this fiscal year. And we offered 2 different COVID testing events along in collaboration with Smoky Mountain Urgent Care and Tallulah Health Center. And that included one where we also offered flu vaccine. So, the wellness and health education, and you can go through each one of these. I won't do as many of them one by one as I did the highlights, but this will kind of give you an idea of what our health educator did last fiscal year. This is our WIC report. So WIC visits, you'll notice, fell off pretty drastically because of that auto issuance. So it actually, our caseload actually increased, where our number of WIC visits drastically decreased. And that's because they do auto issuance at the state level. And they don't have to come in person and be seen in the WIC office anymore. So it translated to a lot of virtual. And part of the issue, virtual is great. The part of the issue with that is this right here. They lost over $30,000 of WIC redemption because the problem with auto refill doesn't mean that they're actively participating in the program. So if it auto refills their card, that doesn't mean they go spend it. Whereas if they come to the WIC clinic, we do reminders for them, we can do food package changes, we can show them how to use their food package effectively, and it just kind of keeps them engaged in the program. So while it's nice and neat and handy that they auto issue and auto refill those cards, that does not mean that they're actually using the foods that they're given. So while we definitely appreciate the fact that it was an auto issuance, especially in the heat of COVID, the spirit of the program gets lost a little bit, and you don't have the usage of the program that you do when they come in person. So here's our clinical programs. Adult health stayed about the same. We dropped a little bit in the number of patients seen. Number of visits actually stayed about the same. So, and the difference in patients seen and number of visits is obviously you can see the same patient multiple times. So whereas visits is what you actually bill for. So breast and cervical cancer, we got an increase last fiscal year. So 2019, we have a cap. We're only given a certain number of BSET participants. So we had 21 participants in 19 and 20, and we had 23 participants last fiscal year, and I think we actually got another increase for this fiscal year because we utilize all of our BSET slots, which is excellent. So yeah, we will probably be seeing another increase again for this coming fiscal year. So here's all of our clinical programs. This was for child health, and obviously this is when we gave up child health as far as assured it through Tallulah Clinic, and we started separating out immunizations at this point as well. So family planning went down just a little bit, but also at the end of 2020 or 2021's fiscal year, we lost our provider. She went out for surgery. So I think all of June we didn't even have family planning clinic. So we did see it drop off at the end of 2021 fiscal year because of absence of our provider.
We just now got her back.
Yeah, so we'll probably see another hit for this fiscal year because she was gone for 4 months. This maternal health, this is just how many pregnancy tests we run. So STD clinic, And it went down a little bit in the number of patients seen. The number of visits stayed about the same. And these are our labs. Again, stayed about the same. We did a few more that we sent off to the state lab. LabCorp went up by about almost 200, about 150, from 478 to 639. We had a pretty big utilization of our lab services, which is awesome. Dental went up dramatically, as you can see, and that's because Macon County and Clay County both shut down to a lot of dental services. So when they did that, we got all the load, which is good and bad in that we are seeing an overwhelming number of patients at this point. So the patients went up by about 600 and the procedures almost doubled because of all the work they're having to do on the patients now. So as you can see, the cleanings went up, everything went up. Fillings went up a little bit. Root canals, extractions, they did a ton of extractions last year. X-rays went up by 500, sealants went up. So yeah, our dental services went way up. This is CAP. So they started doing home visits in March of 2021 and then suspended it again in June of 2021. So they were only able to do home visits for about 3 months and then it shut down again. So, and they also have, it's been frustrating with this particular, what's been frustrating about this particular program is the state has taken over the admissions. So now our CAP program is at the mercy of the state to process somebody's paperwork and enroll them in CAP. And as a result, Christine said it's taken at least 3 or 4 months, whereas it used to take a handful of weeks to get somebody enrolled in CAP. So now, where we have a caseload, I think of 77 or 78, we are at a record low 63 people enrolled in CAP. In the 4 years that I've been here, I've never seen it below 4. And she's having a tremendous amount of trouble with the state processing paperwork. And like I said, she finally got one back that she submitted to be enrolled. And she submitted their paperwork, I think she said in June or July. And she just got it back. So I've been on the phone with the state about it. She's been on the phone with the state about it. So it's been a pretty severe issue because CAP is a very needed service. So, yeah, we're pretty disappointed in that. But we're trying our best to work with it. But, you know, we'll just have to see.
How many down are you right now, Beth? Aren't you usually at about 77 or so?
Yes. Yep, and we're down to 63. Yeah. Yeah, so and it does put us at risk for losing some of our slots, which is terrible because it's not our fault.
Yeah.
So yeah, that's where we're sitting right now. So this is food lodging. So let's get on down. All right, so total number of inspections, 2020 and 2021, the total restaurant inspections went down because they changed the cycle. In response to COVID, they did not have to be inspected as often. That cycle has now gone back to being its regular cycles, but it did change for this particular fiscal year, so it did go down. Otherwise, all the numbers pretty much look exactly like they did last time. We only inspected one pool because Fontana, we do not have to inspect Fontana anymore. So the only pool we have to inspect anymore is the Grant County pool. Fontana, that's part of the reason also you'll notice a reduction in the total number of inspections. Fontana is on federal property and is outside of state regulation. I'm not a huge fan of that because we don't know who inspects their restaurants. They are trying to do a contract with us to get us to do the inspections, but we're having to work with the TVA to get that contract in place, so it's very slow. And having to go back and forth with the legalese and the lawyers and all that kind of stuff. So right now, there is no state oversight of the restaurants or pools on Fontana's property. So, all right. Let's see. Go on down. All right, so here's the number of bacteria samples that we did for Water Lab. Water Lab did increase its use. You'll notice a pretty big jump right here in total coliform. That's because everybody with a spring has decided that they want their spring tested. And we tell them that we do not regulate springs, because if your spring comes back for totocoliform or E. coli, there's nothing we can do about that. There's nothing they can do about that. A spring is an open water source, animals drink from it, things die in it, and there's nothing we can do. So they still insist on getting them tested, and that is they're welcome to do so, but there's nothing they can do about it. So our only thing is we give them a list of installers to drill a well. So yeah, that's why you see a little jump in that. So here is where you see the biggest jump. This is on-site wastewater protection. We went from 62 applications in 2019-20 to 126 in 2020-2021. 44 construction authorizations were given, and 125 were given this fiscal year. So, yeah, you notice a pretty significant jump. Site visits, the same thing. Consultations went from 150 to 500. And same thing with wells. We went from 28 to 37. Well construction or well consultations went from 40 to 100. Which is awesome. I'm not saying that's bad. That's completely awesome. But it eats up a significant, as Jacob knows, a significant amount of time. So, and here's kind of the other little pieces of environmental health. So, yeah. Rabies investigation stayed about the same as it did the last fiscal year. And that's the end of the report. Any questions with that report? I'm messing myself up. I'm looking up at that screen and I'm looking at my screen at the same time.
Have we not ever inspected Fontana's restaurant?
We used to. So what happened was, so when Fontana changed ownership, last year I think?
Back to TVA?
Yeah, back to TVA. That's when it was discovered that, because TVA brought up the fact that they don't get inspected. Where when it was under lease, it just kind of went, and I guess because when you change ownership and change corporate names, you have to redo all that paperwork. So you have to get new transitional permits and the whole thing. And transitional permits are free. All of that's free. But in doing so, things like this pop up. And they discovered, like the tribe, for instance, is federal property, that they have that long MOU that gets signed by the counties that we do their inspections for them. So, and the same thing would occur if it was something else on federal property. Like we don't, for WIC, if you have a Marine Corps base or an Army base or anything, you don't do any of the restaurant inspections on there unless they have a contract. So,
They have inspections on a base internally that's
Right.
happening.
And the TVA could potentially have their own inspectors come in. The USDA could do it. But to our knowledge, none of that's happening. So, and they had reached out to us about it. But the problem is, there has to be some kind of contract in place for us to go in there and have the right to go in there. If their manager looks at us and says, "What right do you have to be here?" kind of thing, that we have a leg to stand on to enforce the code, the food code, which apparently had a pretty big, significant number of changes this year. So we're in October, all of it changed. So, any other questions with the annual report?
I mean,
All right.
Very good.
COVID updates. So our numbers are declining. I feel safe saying that. They are staying at a steady low. There's been some pretty significant changes with the COVID vaccine itself as far as the authorizations. So the boosters have been approved, third doses have been approved, which are two different things. So the biggest difference is third doses are the full dose of vaccine, and booster doses are half of
Just
the
for
dose.
Moderna.
Just for Moderna. We don't vaccinate Pfizer. And so for Moderna boosters, it's half the dose, and for Moderna third doses, it's the full dose. So we have started doing both of those. You gotta get the whole thing.
I'm still good.
So we did start doing those last week, and so did Walgreens. And so we had a full clinic on Thursday. I think we have a moderately full clinic coming up for us this Thursday. Very full clinic coming up this Thursday. And we are doing a mass vaccination event on November the 13th, which is a Saturday, from 9 a.m. to 4 p.m. And we will have assistants coming in for that vaccine event, and we are really pushing for folks to go to that event to lessen the strain on the local resources, because at that point I have made arrangements for people to come in and do all of that. They actually do all of the data entry, they do all of the vaccines, they handle the entire day. All we have to do is just basically help people in and out through the traffic flow, answer any questions they might have, that kind of thing. But the big, heavy burden of the actual vaccine event is actually handled by outside sources. So we are strongly encouraging folks to come to that vaccine event. It does look like the 5 to 11-year-old Pfizer will be approved by then. It has gotten its FDA approval.
And we are in line to receive doses for those children. So
Yes.
we will be giving Pfizer doses also at the health department for
Yeah.
children.
For children, and it is actually a different vial. Apparently one's a different color cap than the other one, because the dose is very different for children versus adults. So
What's that age group?
5 to 11. The 12 and older get the adult dose. So it's just that pediatric of 5 to 11-year-olds. They are expecting down to 6 months by Christmas or the first of the year.
That's all FDA approved, so they
Right.
went through that process.
Right. So, and they will be offering, provided that the pieces are in place with the FDA approval and CDC approval, they will be offering it at the November 13th event to children. So, we also today posted on our Facebook page, Dr. Jernigan with Swain Pediatric Care or Harris Pediatric Care, posted an excellent video on their page that I linked to our Facebook page about vaccines in children, and he didn't just do the COVID vaccine, he did all vaccines, and their efficacy rate and how safe they are and that kind of thing. It did a really, really good job. So if you have any parents that are concerned or they have questions about the vaccine, that presentation is about 30 minutes, so it's long. But it does a really, really good job of answering some really crucial questions about the vaccine. So including what does it do when it goes into your body, how long does it stay there, that kind of thing. All of that is answered in that video. So then he does a really, really good job. But we will be able to vaccinate children at that event. And as a tag on to that, we will also be for every vaccine given, so it can be a booster dose, it can be a first dose, for anybody that's vaccinated, they'll be given a card, and on the card it's going to have different children's programs. So it's going to have 4-H, the band, school sports, parks and recreation, and, oh gosh, who was the fifth one? I knew I was going to forget. Let's see, the band, school sports, parks and recreation, 4-H, and the HOSA club. So that way they can choose their program of choice, and then $50 will go to that youth program. We have gotten the grant funding, so it's already paid for, it's already there. And if we run out of money, then we'll just go request more money. So we didn't cap it at a dollar amount just because We can always go back to our grant funders and see about getting more funds if we have more people seek the vaccine. And with the ultimate goal being number one, obviously it'll benefit a lot of youth programs in Graham County, which is fantastic, but the real purpose is to try to get our vaccination rates up and get everybody fully immunized before the next wave hits.
Yeah.
And this is something that Loretta and I talked about earlier, because they are expecting the next surge around Christmas, and I don't know if it'll be another variant. This is something Loretta and I talked about earlier, or if it will be the Delta people that had it and were naturally immune wearing off at that point, and becoming reinfected, which is what we saw this year. We had seen people that were having it for the second. Did we have any third times or just second times?
Not yet.
Not yet.
Just second.
Just second times.
And we're
So
seeing many more what they call the COVID long haulers. We're seeing people that had COVID, some of them even 8-9 months ago, that thought they were doing well. And we've had a few re-hospitalized. Some of the COVID effects are starting to show.
Keep in mind, the board also agreed to just let them know if it's, if it's looking good, successful, they've agreed to potentially put some more money towards it as well.
good. That'll be awesome. Yeah, I mean, it's, I'm always a fan of raising anything to do with youth programs and funding youth programs. And I think this is a good way. I mean, because we've all seen the lotteries done around the state. You get a gift card, and to me, that's fantastic. But I feel like this is more of a benefit to our whole community, not only in somebody getting immunized, but then giving back almost. So, and some of the programs we picked, especially like HOSA and 4-H, don't really get those big influx of funds like that they could potentially get with a fundraiser like this. So we're pretty excited about it, and like I said, we're really pushing it to try to lessen the burden on Walgreens and lessen the burden on us and Tallulah Clinic, to go ahead and get everybody vaccinated. They have the potential to do hundreds, I don't know, even over 1,000 vaccines that day if enough people show up. So, and that way it will lessen the strain on our local resources. So.
Do we have a local Special Olympics chapter here too that could potentially benefit?
Yeah.
That could be an option.
Yeah, and actually under the school sports section, I guess they could check that if they wanted to, and just write Special Olympics under there because the school handles that, don't they? Yeah.
That's good.
Yeah, so, and we can make a note of that on our Facebook page too, especially as the event draws a little bit closer. And like I said, we'll use that November 13th event to kick off the fundraising, and we're planning on running it through the end of the year or when we run out of money. So we're hoping to run out of money, but at least run it through the end of the year to raise as much as we can for the kids and to get as many people as we can immunized at the same time. So environmental health updates. It's just been crazy. It's been crazy. Allie took a job elsewhere, and so we have actually had some interest. And that'll kind of segue into that one right below it, which is the reason I put it below it. We actually have had 3 or 4 applications for that particular position. And we've also had a few applications we're getting ready to fill, hopefully the CAP position here in probably in the next couple of weeks. And I've got some applications in for our human services planner, which is the preparedness, which is a huge void for me right now because I'm having to do all of the preparedness planning and COVID and that kind of stuff. So, but I'm pretty proud that we've gotten as many applications for all 3 of those positions as we have. I'm very excited about that.
Some good prospects potentially.
Yeah, I think so. And it didn't even, most of ours have actually come through Indeed, which is very handy. I love Indeed now. And it hadn't even hit the listservs for the state yet. So I did, I sent it to the state to be put on the listservs, and I found out today it never was. So the other health departments in the state don't even know that the position is open. So I actually reached out to another county and asked their environmental health supervisor to please put it on the listserv for me. So the applications we've gotten haven't even been from other health departments. It's just been people that are interested in doing environmental health with us. So, yeah, it's been good. I don't think we're gonna have any trouble doing it. So, any questions with our open positions? Which we can discuss a little bit more in closed session, which we're gonna do today anyway, but that's kind of the generic.
Two questions. One, just curiosity, who left the CAP program?
Jessica Millsacks. Yeah, she moved across the hallway. She went to DSS. So, yeah, she just moved across the hall, and that's the position that we have done interviews for, and it looks like we have a pretty solid candidate. So that one will probably be filled in the next. She's got to make it through the state system and all that kind of stuff, and so hopefully we'll have that one filled shortly.
Do you have hopefully applications from people for the environmental job that are credentialed?
Well, that's what the ones that have applied are not credentialed. And so I was wondering why I hadn't seen any applications from other people in the state, and that's when I reached out to another county and found out that they didn't even know about the opening because it hadn't hit their listservs. So I don't know if there is somewhere. Well, she said she put it on the listserv for me. I'm hoping that she actually does, because I don't get the environmental health listserv. I don't know what it is. I get the health director listserv, but not the environmental health one. So I'm also wondering if there's somewhere else, like NCACC, maybe we could put it.
And
Yeah, to make it list where local government sees it. You know what I mean? Indeed is great, and we've gotten some public health backgrounds. And some environmental health backgrounds. Thing is, they're coming in from other states.
and two, you can probably put it with the regional environmental health consultant, because that's how we